Hello everyone, my name is Dr. Vallabh Chawla and today we are going to do a case report on salivary gland stone. Okay, so patient had basically came with the chief complaint of missing teeth and wanted to get replacement of teeth with dental implants in the lower jaw left and right side. So on taking the mandibular CBCT scan, we came across an incidental finding, whereas as we went down from occlusal aspect to the inferior border of the mandible, we encountered a radio opacity somewhere in the ramus region, close to forehead region. So this is the radio opacity that we found, as you can see it on the axial cross section, and similar radiopacity that was seen in the coronal cross section and in the sagittal cross section. But as we saw in the sagittal cross section, there was some kind of radio opacity that was noted over here, so which was like a tooth like mass or tooth like density that was seen. So this is the thing that we saw in the scan, so we'll just arrange it along the long axis of the tooth. So this is the radio opacity surrounded itself by another low density radio opacity. Okay, so we'll just check this thing. So now we'll just zoom this specific region. Okay, so this specific region is now zoomed. Okay, now we'll just see this thing. This is the tooth like radio opacity that is seen inside the salivary gland stone mass. So we'll just hide these lines. You can see some kind of radiolucency surrounded by tooth-like radio opacity, which itself is surrounded by a radio opacity that is less dense compared to the radio opacity which is more in the inner aspect. Okay, similar radio opacity is seen here, and same thing in the coronal aspect. Okay, now we'll just study this thing same in the 3D volume. So this is the salivary gland stone mass that was seen. There's the axial view, okay, and this is the radio opacity that is seen of this salivary gland stone. We'll just reduce it, and you can see a tooth-like mass that is seen over here. This is like an enamel surface, the root surface partially seen, could be something like that. And this is the radio opacity of tooth-like structure that is seen. You can just see this thing, and this is again the radio opacity of salivary gland stone and that of tooth-like mass. Okay, and now we'll just arrange it again. So this is seen in the as seen from the side profile view. Okay, there is a tooth-like mass that is seen from the side profile view, and the tooth and the salivary gland stone radio opacity. Okay, so we'll just see it from the inner aspect, how it is seen from the inner aspect. This is how it is seen. Okay, so this is the salivary gland stone from the lingual point of view, and we'll just reduce this thing, and you can see the radio opacity over here, which is a tooth-like mass. Now if you want, we can study these cross section format also. We'll just see this thing over here. Okay, from anterior aspect, this is from the anterior aspect to the posterior aspect. The tip of the radio opacity as seen over here, this is a tooth-like mass, and the posterior most aspect. Similarly, same radio opacity is seen here also. This is from the, there is a posterior aspect, and this is the anterior tip, and this is the tooth-like mass. The same radio opacity can be studied in different interval lines, and there is a sagittal view radio opacity. You can see this thing over here. So this is the size of the radio opacity that is seen. Okay, and similar radio opacity, you can see the size of the tooth-like structure. Why we named it as a toothlet-like mass structure inside the radio opacity? Because of it is because of the presence of some kind of radiolucency that was seen over here inside the mass. Okay, so hence we came to the conclusion of intraductal toothlet. So the clinical history is not known. This is the radiolucency, radio opacity, and the outer radio opacity. This radio opacity itself is surrounded by a radiolucency, as you can see it over here. Okay, so this was all about salivary gland stone and an incidental finding of tooth-like structure inside the salivary gland stone. Okay, thank you so much.